I was actually at the point of giving up when I did find Caryn. I had tried for so many years to find relief, and I was not successful.
I did certainly have a lot of pain and stiffness and soreness well after the time when I had recovered from the surgery. That is, in terms of the procedure, it was certainly nice, but from a body point of view, I certainly was very stiff and just felt very beaten up.
For the last couple of years, I've been experiencing some extreme back pain, especially lower back pain. It caused many problems and was not allowing me to live a full life and enjoy the beautiful things that I can do.
I'm a manual osteopathic practitioner, and the question that I'm most often asked is, what is osteopathy? Osteopathy is a holistic form of manual medicine. And what that really means is I use my hands to treat you, and I treat your whole body. So if you come to me with an ache or a pain somewhere or a digestive issue, I'm going to treat that area. But I'm going to look at the rest of your body for other tissues or structures that may be the real cause of the problem or are feeding into your concern or maintaining it. There are many wonderful techniques in osteopathy. I do structural techniques to mobilize painful joints, release tension or strain in muscles, ligaments, fascia. I do cranial osteopathy, more popularly known as craniosacral therapy. This can help the circulation of all the fluids in the body, including the cerebral spinal fluid that circulates around the spinal cord and the brain. It's a very gentle, profound technique that can have a calming effect on the nervous system. I also do visceral manipulation. I place my hands on the outside of your body on the viscera or the organ, and I can feel if it has a normal physiologic mobility or if it feels hard, stuck, or compressed. And if it does, I have techniques that can help free it up, help it function better, and fulfill its role in the whole digestive process.
Caryn was the first person to recognize the source of the trauma and how my body compensates to cope with the trauma over the years. I recognized after a few sessions with Caryn that the treatments I had previously with the other healthcare providers primarily treated the symptoms and not the cause of the trauma, which is what Caryn treats.
So here's a little demonstration of an osteopathic treatment. Eva's come to me and she has some back pain, especially in this area. She has some digestive issues. She suffers from fatigue, which makes me think there might be something going on with her liver. And she has the occasional headache. So the way I'm going to approach all these problems is by testing the spine and probably treating the spine. What's really interesting is this area of the spine where she has the back pain is where the nerves are exiting that innervate the stomach and the liver. So if I come in and I start to test the vertebra should be able to move freely in all directions. So I'm asking them now to just side bend to the left. And sure enough, when I reach this level, there's a vertebra here that doesn't want to freely side bend to the left. So I'm going to go to the other side now and see how it is on that side. On this side of the spine, I'm going to test. And when I reach this level, I can feel that there's more mobility in the vertebrae in their ability to side bend to the right. So often in osteopathy, we work with the body first. We take the body into its position of ease before we go into the correction. So we're both going to relax in this position for a second. Maybe even go a little further. Take a big breath in, Eva, and hold it for a sec. And the tissue's moving. I'm following her body, and now we're going to come back to the other side. That's good. And I'm actually going to retest the other side just in this position, and I can feel there's more mobility in the vertebrae. Now they can side bend easier towards the left. So I've helped her back pain because I've got more mobility in the vertebrae. And I've also released pressure on the nerves that are innervating her digestive tract. I could also treat her craniosacrally, which has an effect on all the nerves exiting the spine all the way down. I could treat the viscera or the organs directly. So I could place my hands right on the liver and the stomach and treat them directly, help them function better, gain a bit more mobility. And the other thing I could do is I could treat the vagus nerve, which is innervating the whole digestive tract, again, liver, stomach, etc. And it exits the jugular foramen underneath the skull here. So if I come into this area, which is often very tight on people, especially if they tend to have headaches, I can relieve the pressure on the vagus nerve to help it function better. And I can help her with her headaches. I can even take the pressure off the trigeminal nerve, which is the chief sensory nerve for the head. So that'll help the headaches. So that's an example of how we treat holistically.
I got up from the table and I felt so fantastic. I just couldn't believe that I could actually be pain-free that quickly. To do a follow-up was important because nothing turns around overnight, and after about 3 sessions, I don't have the issues that I did have before I started seeing Caryn.
I'm now getting my life back, and the life I knew before the car accident. The pain has changed and lessened, I'm happy to say. The foggy thinking has disappeared, and in fact my memory has also improved. I have no digestive problems at all. I have more energy than I have had in a long time, and I have more flexibility in my body. I feel so much happier and calmer now, and I know I'm not 23 any longer, but I sure do not feel my chronological age.
When asking about treatment about these issues with the conventional medicine, people in conventional medicine, they really did not have anything specific to offer about it. They just mentioned that it'll go away with time. She's dealt with the source of the problem rather than deal with the reduction of the pain.
The thing that makes osteopathy really different and exciting to me is that it's about all these connections. So we have all these different techniques, and we tie them all together like a beautiful web to have the greatest therapeutic effect. And that's a little of the science and the art of osteopathy.
So I found something finally that worked, and now I'm doing all those things again, and it's absolutely fantastic. I don't worry about the pain. Sure, I get pings and pangs like everybody else, but I don't have those chronic issues. Now I can stretch it out and get back to normal within an hour afterwards if that's the problem. And if I feel like I need a top up, I just go and see Caryn because she rocks.